Okay, thanks for hanging with me. Now that we've discussed original Medicare and we've discussed the options for receiving healthcare coverage, I've introduced this Part D concept to you. Now it's time to get into the detail of Medicare Part D, drug coverage. Remember, original Medicare does not cover prescription drugs, so you're going to have to get a prescription drug plan. If you do not get one and later you decide you want one, you are going to pay a late enrollment penalty for that will stay with you forever. So it's important that you get one when you're initially eligible. Here's how it works. If you follow along in the brochure with me, you'll see that there's an arrow across the top of the page. This illustrates the different payment stages of a Part D plan. These stages are the same regardless of carrier. So you're not going to have a difference between carrier A and B with these stages. The first stage is called the initial deductible stage. Remember the term deductible. That is what you pay out of pocket before the insurance company pays anything. There are many plans out there that have zero deductible for prescription drugs. Not all of them, but they do exist. So if you have a deductible in your plan, you are going to have to pay that first, and you will be subject to this payment stage. If you do not have a deductible, obviously you will not pay that and not be subject to this payment stage, and you will go over to the next stage, which is called the initial coverage stage. The initial coverage stage is what most of us are probably used to in our private insurance group health plan world. These are your deductibles and your co-pays. So your $2, your $4, your $8, etc. Okay? You will have a co-pay or co-insurance amount depending upon the drug that you will pay according to your plan design. Let me give you an example of how the dollars are tracked. Medicare keeps track of, via your health provider, they will keep track of the total cost of your prescription drugs. The total cost will be what you pay in the form of a copay or co-insurance in addition to what the insurance company pays. So my father is on a drug called Eliquis. That drug cost him $50 in terms of a copayment in the beginning of the year. But the total cost of the drug is $500. So he pays $50, the drug company pays $450. The $500 is what's being tracked, not his $50 portion. So Medicare keeps track of that $500 a month, and when that total cost exceeds $4,020 in 2020, and again, that number is subject to change every year, when that total exceeds $4,020, then you go to the donut hole, or also called the coverage gap. In the coverage gap, the way that you pay changes. You're going to pay 25% of the cost of the drug, whether it be a generic drug or a brand name drug. Once again, they are going to keep track of that until the costs get over $6,000, $6,350 to be specific. So let's go back to my illustration. That $500 a month, my dad was paying $50 in January. But the total cost, if that was the only drug he was on, of $500 a month is what's being tracked. So $500 a month for approximately 8 months would give us $4,000. So that means in August or September, he is going to slide over from the initial coverage stage to the coverage gap stage or donut hole. For many people that are on a high cost drug, you're quite likely going to experience the impact of the coverage gap or donut hole at some point during the year. So that 25% of $500 is what he will be responsible for instead of the $50. Once you exceed $6,000 in total costs, again, track both yours and the insurance company's cost, then you will enter the catastrophic coverage stage. This is the stage where you will pay, quite likely, the least amount that you would pay during the year for your drugs. It's the greater of $3.60 or 5% for generic drugs, or $8.95 or 5% of the cost for a brand name drug. The pendulum swings out of your favor in the donut hole and swings a little bit back in your favor cost-wise if you go into the catastrophic coverage stage. On January 1st of every year, it starts over. So the calculations reset at 0 January 1 and they start over. And if everything remained the same, for example, then my dad would be in the donut hole next August as the same he was in this August. There are some other key facts to keep in mind when it comes to Medicare Part D. You have to get Medicare Part D, as I mentioned earlier, or you'll be subject to a late enrollment penalty. There is a program out there called Low Income Subsidy, also referred to as Extra Help, provided from the Medicare system, that will help low-income earners with their premiums and their deductibles and copays. It's easy to determine if you are eligible for the low-income subsidy or extra help, either by contacting Medicare directly or contacting us, and we will help you determine that as well. With any Medicare drug plan, there's a list of drugs called a formulary. This is what the formulary looks like for one carrier. You can see how thick that is. Quite simply, a formulary is a list. It's a list of drugs from A to Z that particular carrier is going to cover in their benefit plan for the upcoming year. It's important for you to understand how your drugs are handled within the formulary for a particular carrier for the upcoming year. I'm going to explain the formulary and the tiers in a little more detail later.